Ladies and gentlemen, I'm here to tell you my personal experience with this stomach flu. I had it last week. Luckily, it only lasted for a few hours for me, but for my son, it lasted 2 days. So he had a much worse experience than I did. So be careful out there. This thing is highly contagious. And it started in the Northeast, but now it is moving across the country. This thing, y'all, can last in some people up to 14 days. So it's extremely contagious. And this is the second video I've done on this. I did one about a month ago, but then I did not experience it. But, the news stories were coming out that it was really spreading in the Northeast. Now it's in the Northeast and the South. And this is where it's surging and it's spreading as we're in spring now. It is spreading a lot more. So this is a respiratory virus, and this one they feel may ultimately go national as it continues to circulate, and they're expecting it to continue to spread through April according to the CDC. So it is Norovirus, also known as the stomach flu. Some people label it as food poisoning. It spreads very easily among people. I sure don't know where I picked it up. We don't know where we got it, but we did have it. As cases and outbreaks spike across the country, public health officials are urging Americans to take precaution to stop the spread. So they said they call it stomach flu, but it's technically, um, not related to the flu at all. They are saying that, now this is something my son experienced. He had the inflammation from it, of the lining of the stomach and intestines per the CDC. This can result in bouts of vomiting, diarrhea, nausea, and stomach cramps. The symptoms usually begin 12 to 48 hours after exposure, and it's really sudden because, look, when I got hit with it, the early part of the day, I was fine all day. I was feeling like my normal self. I didn't notice anything unusual. It hit me at night, like around, I would say it was like around 9:30 at night. That's when it was like it came from nowhere. So, they're saying it is, sudden, very unpleasant. Yes, it really is. But most people will, you will recover. I know I did, and you will too if you happen to get it. Um, this is the dreaded virus that leaves us in the bathroom for a day or two, and that seems to be the norm. Now, in unusual cases, they said some people can go a straight 14 days. That is absolutely insane to me. Very insane. So, they're saying anyone can be affected. In fact, I was looking online and there was a school that they had to close because the students got hit with it. So they closed the school for about a day. It really was not that big of a deal. So every year in the US, they said they get 20 million cases of the stomach flu. 465,000 people end up in the emergency room with it. 109,000 people are hospitalized and 900 deaths, according to the CDC. But most people don't. end up like that, and I'm grateful for that. So, according to the latest data from laboratories across the country reporting the CDC, they're saying the tests are coming back positive, average over 3 weeks. And it said it has gone up 12.2% as of March 9th, and it's up 9% from mid January. The outbreaks are also rising steadily in recent months from August 1st, 2023 to February 12th, 2024. There were 759 outbreaks reported. 15 states participated in the Norostat surveillance. So, y'all be careful. Make sure, be careful, especially if you're at work or in any kind of place of business or restaurants and touching surfaces, because that is probably one of the biggest ways people are getting it. And it don't take much. All you got to do is come in contact with someone with it, which I believe I did. I don't know who. I don't know who it was, but I think we just had contact with someone that had it. You don't feel the symptoms until it could be up to 48 hours. So the person might not have even known they had it at that time when they came in contact with me. So generally, they say, you normally see an increase in the stomach flu in the winter months and are continuing to monitor. So there was an increase, at least in the Northeast, it was. So now they're saying there are outbreaks. They're picking up more outbreaks that are occurring nationwide, but certain regions of the country are getting hit harder than others. The Northeast has the highest positivity rate of any region and is currently circulating at the highest levels as of April of last year. Percentage of tests coming back positive in the Northeast, averaged over 3 weeks, was nearly 14% as of March 9th. And cities such as Philadelphia have reported spikes of the stomach flu, prompting public health officials to urge residents to take precaution. Data from the Northeast region of the United States looks similar, what we could expect for this time of the year. So, the next hardest hit region in the US is the South, which saw a 3 week positivity rate of 13.5% as of March 9th. This is according to the CDC, followed by the western states of the US. So, an elementary school, Fairhope, Alabama, was closed for 2 days. I think this is the school I was talking about, but I thought I saw 1 day, but that's okay, 2 days, due to a suspected outbreak. And they said it was an alarming number of students and staff that were reporting um, the stomach flu. We're seeing a big spike in California. All right. And this is Joanna Turner, which is a family medicine doctor. And they're saying the infamous stomach flu is also spreading at sea. Since the start of 2024, there have been confirmed cases on cruise ships of people getting sick, by hundreds of passengers getting sick on these cruise ships, according to the CDC. Why is it surging? I think it would get worse being that it's now getting warmer, but hopefully it'll kind of fizzle out. I sure hope so. Now, they're saying the biggest outbreaks normally occur between November and April. So hopefully it's coming to an end. I sure hope so. I sure don't want to get it again. So during the colder months, people tend to spend more time gathering indoors, which makes it easier for infectious diseases like the stomach flu to spread between people. So the current surge is not surprising to experts. Last winter was also a tough season for the US as the same stomach flu activity rebounded to pre pandemic levels following the drop during the pandemic. They said it did drop when we were all indoors, locked down. Yeah, it dropped for a moment. Cases peaked in early March of 2023. Um, but they said it did remain high into the spring before it started subsiding. So I believe most of it is airborne as well. So, y'all, please tell me what you think. Let me know if you got hit with it. I did hear about a few people just talking to family that said they felt sick, like they had it. So I hope everybody stays in good health. I don't wish this on my worst enemy. And I wish a lot of things on my worst enemy, but this is not one of those things. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.